Hello everyone and welcome to another episode of Ask Dr. Bob. Tremendous questions. Let's get right to it. An individual contacted me and said that she just had her third baby. She's tired and has headaches. Probably post-baby liver syndrome. You say, what does that mean, Dr. Bob? The liver takes a beating on women when they're pregnant because your liver has to help the baby along the way. And in our office we can take digital films of a person's trunk and their body. We see a lot of enlarged livers. Something else post-baby could be subpar thyroid. If you wake up with a headache in the morning after you've had maybe some fruit or something sweet to eat the night before, think thyroid. Another individual wanted to know about her 4-year-old child. It was a young boy that was having dry skin during the wintertime. It really comes down to oil. Black currant seed oil is great for eczema, and I'm not saying it is eczema, by the way. Water is really important because we become dehydrated because of the atmospheric pressure. And also calcium is really important for young boys and girls that are growing. So those 3 items, black currant seed oil, water, and calcium. Calcium that's acidified like calcium lactate or citrate. Somebody wanted to know, what type of products do we use for rheumatoid arthritis? What's really is exciting is that Biotics Research Corporation has a product called Bio B3 Plus. I don't talk about it a lot, but we're going to start using it in our practice for people who have a desire to smoke cigarettes. The niacinamide in this product takes away inflammation, but the niacinamide in this product will help rheumatoid arthritis, osteoarthritis, and for those of you that are craving nicotine via cigarettes, it could be the answer. Contact us for that. We had an individual, her name was actually Christina. She was on a low-dose birth control pill, and for whatever reason, ever since she gained a lot of weight, her hormones in her body were topsy-turvy. And what's going on with her, and with so many of you, is extra weight in your body. That abdominal fat creates hormones. It's a toxic dump. I have to congratulate her. She mentioned that she's lost about 45 pounds. You know, I would continue on focusing on eating green vegetables and protein, drinking water, and exercising. That will help a lot. You may consider something called calcium D-glucarate to get rid of the extra estrogen in your body. An interesting question from a woman that was having some challenges with snoring. Her husband, I think, was quite upset with her. Wanted to know what a remedy is for snoring. Well, first I want you to know, if you lay on your back and you have any kind of extra weight in your body, your extra weight is going to compress your lungs. So sleep on your side. And I have found that a lot of individuals snore when they eat wheat. I know that might seem a little absurd. Wheat? Of course. So if you snore, start tracking what you're eating. Actually, any one of you, track what you eat before you go to bed. And then if you're finding a pattern, but wheat seems to be an issue. Somebody else wanted to know about depression and the winter blues. She wanted to do a light therapy for depression. I would consider an essential fatty acid blood spot test because you probably have low DHA, which is a long-chain fatty acid, which we talk about in Dr. Bob's Trans Fat Survival Guide. Also, I've noticed that people who are depressed have subpar or low thyroid. So you may consider TSH, T3, T4, and a TPO. Get that thyroid going. Make sure you're getting some flax oil. Essential fatty acid blood spot test would be tremendous. And finally, a young lady contacted me, wanted to know about hair on her lip. And even with waxing, the hair grows back. So I did a little bit of extra research. I get this question asked quite often. It's usually hyperfunction of the part of the brain called the pituitary gland. And we have a strategy for helping improve that. I have learned a lot of times if someone's underneath stress, it can cause that pituitary gland to be quite active, but we use a product called E-manganese and a few other items that we use to help check that out. Probably wouldn't be a bad idea to have some saliva testing done to check out your hormonal levels to make sure that you don't have a cyst on your ovaries that's making testosterone. Wow, you're going to want to watch this one over again. I'm Dr. Bob DeMaria.